The 5 Most Dangerous Health Problems for Americans. Part 2. 6. Population. Over 8% of Americans lack health insurance. Costs. High out-of-pocket expenses deter preventive care. Health disparities. Marginalized groups face higher rates of chronic illness due to systemic barriers. Measures of access to care tracked in the National Healthcare Quality and Disparities Report, NHQDR, include having health insurance, having a usual source of care, encountering difficulties when seeking care, and receiving care as soon as wanted. Historically, Americans have experienced variable access to care based on race, ethnicity, socioeconomic status, age, sex, disability status, sexual orientation, gender identity, and residential location. This section of the NHQDR discusses trends in access over time and disparities in access related to the sociodemographic variables for which data were available. Of the 9 measures assessed, 5 access measures were improving. Of the measures that showed improvement, 2 measures were related to health insurance. 2 measures were related to timely access to care. 1 measure was related to patient perception of need. 1 measure related to patient perception of need was worsening. The remaining 3 measures showed no statistically significant changes. 7. Environmental and occupational hazards. Air pollution linked to respiratory and cardiovascular diseases. Cities with poor air quality are hotspots for asthma and COPD. Water contamination. Lead exposure, e.g., Flint water crisis, causes developmental delays and other health issues. Occupational risks. Injuries and exposure to toxic substances in industries like construction and agriculture. Environmental hazards come in many forms. From extreme events like natural disasters to toxic substances like heavy metals, chemicals in consumer products, air pollutants, and radiation, all of which threaten human health and well-being. Public health aims to assess these hazards through related disciplines like toxicology, inhalation science, dosimetry, and more. 8. Lifestyle-related issues. Diet. High intake of processed foods and sugar contributes to obesity and chronic diseases. Physical activity, sedentary jobs, and screen time limit physical activity. Stress. Chronic stress leads to hypertension, mental health problems, and weakened immunity. Sleep. Sleep deprivation is linked to obesity, diabetes, and poor mental health. Today, wide changes have occurred in life of all people. Malnutrition, unhealthy diet, smoking, alcohol consuming, drug abuse, stress, and so on are the presentations of unhealthy lifestyle that they are used as dominant form of lifestyle. Besides, the lives of citizens face with new challenges. For instance, emerging new technologies within IT such as the Internet and virtual communication networks led our world to a major challenge that threatens the physical and mental health of individuals. The challenge is the overuse and misuse of the technology. With a look at existing studies in health domain, 9 key factors can be suggested for healthy lifestyle. In regard to each factor, The systematic planning in micro and macro level can be established. It can provide a social and individual healthy lifestyle. 9. Health disparities, racial and ethnic minorities. Higher rates of diabetes, hypertension, and infant mortality. Rural areas. Limited access to healthcare facilities leads to poorer outcomes. Low-income populations face barriers to nutritious food, exercise opportunities, and medical care. There has been heightened focus on health disparities and their underlying causes in recent years. These disparities are not new and reflect long-standing structural and systemic inequalities rooted in contemporary and historical racism and discrimination. This brief provides an introduction to what health and healthcare disparities are, why it is important to address them, what the status of disparities is today. Recent federal actions to address disparities, and key issues related to addressing disparities in the future. More detailed information on this topic can be found in KFF's Health Policy 101 chapter on Race, Inequality, and Health. 10. Aging population, Alzheimer's disease, 6th leading cause of death. No cure but manageable with early detection. Arthritis, leading cause of disability among older adults. Osteoporosis, weakens bones, increasing fracture risks. Falls, major cause of injury and death among the elderly. Sixth, access to healthcare. Uninsured population. Over 8% of Americans lack health insurance. Costs. High out-of-pocket expenses deter preventive care. Health disparities. Marginalized groups face higher rates of chronic illness due to systemic barriers. Measures of access to care tracked in the National Healthcare Quality and Disparities Report, NHQDR, include having health insurance, having a usual source of care, encountering difficulties when seeking care, and receiving care as soon as wanted. Historically, Americans have experienced variable access to care based on race, ethnicity, socioeconomic status, age, sex, disability status, sexual orientation, gender identity, and residential location. This section of the NHQDR discusses trends in access over time and disparities in access related to the sociodemographic variables for which data were available.